Amref is an African indigenous international organization based in Nairobi, but with country programs, about 9 countries in Africa. Here in Uganda, Amref has been here for about the last 33 years, and we came at the invitation of the Ministry of Health to strengthen the health system in northern Uganda after the war had occurred. After we had done the health system strengthening there was much need in the country to support government to provide primary health services, but other developmental interventions. Our programs have covered our 3 main strategic areas. One, strengthening the numbers and quality of the human resources for health in the country. 2 programs related to providing services on health and WASH and general community empowerment, as well as promoting health financing in the country. We have, as part of our system strengthening, gone out to empower health workers with knowledge and skills in the areas of maternal health, adolescent health, child health, water hygiene and sanitation, and more recently, since the last 2 years, COVID-19. We have provided services to over 2.6 million people, and these services include safe deliveries for mothers, include provision of safe water to over 100,000 people. We have provided COVID management for those who are sick, but also prevention of COVID-19 through promoting SOPs, ensuring that health workers who are working in the COVID environment are protected as they provide the services, but also the communities are observing the SOPs to avoid the spread of COVID-19. We have continued to provide services related to vaccination, and actually currently we are doing a mass vaccination of COVID-19 in the Mubende region, covering 8 districts and targeting over 1.3 million people. Amref was one of the early responders in the COVID-19 response. We first of all joined the national task forces in the areas of community engagement, case management, surveillance, risk communication, and we were able to contribute our knowledge and advice on how the response should run. Then we went, as we usually do in the districts and communities, we did community sensitization, we did strengthen the knowledge and skills of health workers on how to address COVID. We provided personal protective equipment worth over $250,000 US. We also went ahead to work with the districts to coordinate the response. More recently, we are also supporting the accelerated mass vaccination campaign, and we target to vaccinate about 1.3 million people in Uganda. We've had to do reprogramming, and that means that you have to renegotiate some programs, some projects with the donors, and this reprogramming helped us to mobilize money that we initially did not have to actually invest in the response to COVID. So also, of course, I worked with the senior management team here at Amref Health Africa in Uganda, also to keep the areas they lead, not only a program, but human resources, finance, administration, IT, to keep the system of the organization running. The program continued to run, and our services have reached 2.6 million people, which is not very different on what we have been doing annually in the previous years, even without COVID. For the third year in a row, we are, as Amref Uganda, we have above the financial threshold that we need to maintain in the country. The other was the strong partnerships that we built in this difficult year. We now working very strongly with the WHO, the Ministry of Health, Ministry of Gender, the Netherlands Embassy, all the 54 districts. We have very good cordial relationships. We have partners for whom we are sub-recipients, and we have been having very good relations with them. Regarding systems, Uganda remains the front runner in strengthening our systems developed from HQ or adapting from our environment. We have a stronger IT system, more secure. We have digitized some of our processes. For example, we introduced now GIS mapping, which we didn't have before. So we are able to link our interventions to geographical locations. We've been able to develop a one-stop digital solution that links service providers in the wash sector to those who would want to get services. The application is up and running, fully tested, and it's ready for scale-up and commercialization. 2022 will see us climax on the last year of our 5-year strategy. And so we want to consolidate our areas where we've done very well. Pillar 1 on human resources for health capacity strengthening, Pillar 2 on service delivery, and also pick up on Pillar 3, which is health financing, promotion, and try to get last mile wins. We want to expand our partnerships as we try to work on our sustainability strategy, get new partners, rekindle relationships with the old ones, so that we are grounded in the work we do as we develop new business. We did it in 2021 with COVID. We can do even better in 2022 now that things are freer. For me, I think our team is the greatest resource that we have, and I trust that they are the team members that are going to get us where we are going. The team has been great, has been resilient, and I couldn't work with a better team than I have now. So thank you very much, and congratulations upon steering through even this year 2021, and I wish them a very, very prosperous 2022.